benefits of having a practice-based pharmacist for us at Hillview has been immense. If I was to distill it down to 4 examples, one example might be benefits to patients. They have a much more readily accessible point of contact for their medication queries. For receptionists, they've got a point of contact and they don't have to wait for the doctor to be free before their query is answered. From a nurse's perspective, they have an extra peer review of their work and also someone who can actually prescribe the drug that needs to be prescribed rather than having to wait for the doctor to prescribe. And from a doctor's perspective, workload has certainly been reduced. From paperwork, from sorting out medication queries, reconciliation drugs, medication changes from outpatients, I could go on.
I think for myself, it's from the patient point of view, it's having the time to speak to a healthcare professional who knows about medication and is able to give them as much information that they need about not only their medications but their conditions as well, and take that extra time with them to find out about what their problems are with their medications, and also dealing with long-term conditions, ensuring patients are monitored appropriately and having the time to follow things up as well. And from a team perspective, I think the role allows you to become an integrated member of the team, and I find that lots of our multidisciplinary team are aware of the role and use the role and use me when they've got problems with queries or patients, and use my expertise. So I feel as an individual I'm really developing and putting into use all the clinical skills I've learned over time in my career.